Well, a warm welcome to this talk, Monday the 2nd of May. Now, coronavirus is going to be with us for some years, unfortunately probably a decade or two or even three into the future, and cases will come and go. I believe that the trend that we've seen so far of widespread transmission but lower pathogenicity is going to carry on. And for the short term in North America and Europe, as we go into the warmer weather, it's looking very promising indeed. I'm expecting the numbers of infections to go down and the number of hospitalizations to go down as well. And this is really surprisingly good news, particularly for the States, because the Omicron BA2 bounce is absolutely tiny compared to what I personally had feared. So I'm quite happy to come back and say I was overly pessimistic about the United States Canadian BA2 bounce, and I'm delighted it's much smaller than I thought it was. That's a long way of saying I got it wrong. It's much better than I thought it was going to be, so that's really good news. I had thought it would follow more the UK pattern, but I think there was so much natural immunity in the United States compared to the United Kingdom that the United States has really done quite well. But let's just look at a bit of data to support these ideas. Now, the actual number of cases, of course, represent a very small subset of the infections. So hardly worth doing anymore, but we'll do it anyway. So Australia and New Zealand do actually have more cases. The United Kingdom, Canada, the United States, testing is, or reported testing is very poor, so we can't make much of that at all. Going on to variants, of course, it's all Omicron. United Kingdom, there's probably a bit of XE creeping in there, which is this recombination, which is partly BA1 and BA2. Unfortunately, our world in data is not differentiating at the moment between Omicron, BA1 and BA2, but we can know that the vast majority of this now, I think we can say everywhere, is BA2. I think we can be fairly definite about that now, which means it's spreading even more quickly. Now, this next slide here, this is the important one, of course. This is hospitalizations. Now, the United Kingdom is going down. It had been quite a bit higher in the UK, not to the point where it was causing huge concern, but it's been certainly delaying a lot of ordinary treatments. I was just listening on the news today. There's over 2 million people actually reporting now for cancer screening in the UK, having been way down in the pandemic. In other words, we've got this big catch-up operation to go through, so the quicker we can stop having COVID patients and isolating COVID patients, the better, because we've got this massive backlog to deal with. And make no mistake, people have been dying through lack of medical care all over the world, and I believe that's true of every country. Some countries more than others, of course, but it's been a major tragedy for not treating other pathologies as we have focused, some may say over-focused, on COVID at the expense of other conditions. But here we see the hospitalisation position. So down in the UK, Canada second, and this is accurate data, of course, we know this is accurate, then Australia, Netherlands. This is so good to see the United States so low and South Africa low. Bear in mind, of course, South Africa probably will have a slight increase in cases now because they're going into their winter, being southern hemisphere. Now, this slide here, number of COVID patients in intensive care, it's gone down continuously since the Omicron wave started. Omicron has been the best news for intensive care units ever. Numbers have gone down everywhere. Well, as we say, everywhere. I'm not presenting evidence for that. I'm presenting evidence here for Canada, Australia, United States, United Kingdom, Netherlands and South Africa, where the numbers have clearly gone down. Slight increase in Canada due to the sheer volume of numbers in their BA2 wave. So pretty good news for intensive care units. This slide here is confirmed deaths. Now, again, Omicron has clearly brought about some deaths. This is the start of the Omicron times here. And just because of the sheer numbers, for example, we see it's been high, frightfully high, in fact, in the United States, but now going down nicely. So United Kingdom deaths are going down. Still higher, though, New Zealand, Canada, Australia, United States, Netherlands, South Africa, India, in that order. And again, because these are deaths, we know that this is fairly accurate data. And the best way, we've sort of decided this, that the best way to estimate mortality in this pandemic is not to look at deaths where COVID is on the death certificate, not really to look at deaths 28 days after a diagnosis. Both are immensely useful, of course, but ultimately excess mortality is probably the most accurate indicator. And here we see a graphic for that. Excess mortality. Now, this is cumulative deaths from all causes compared to projections based on previous years. Now, the way that this data is collected does vary from country to country. In the UK, typically we take the average of the 5 years previous or the 5 years before the pandemic. Different countries will do it slightly differently, but yet this is an accurate representation of excess deaths. And there we see it. South Africa's had the highest number, 23% above normal. Then the United States, then the United Kingdom, then Netherlands, and New Zealand has actually had less deaths so far. And I believe Australia is also in negative territory. Yes, it is, because that's the zero line there, and we see that Australia is also in negative territory, less deaths than the previous 5-year period. So pretty good news in the Antipodes. Now let's go on to the Zoe report. Always very useful to look at the Zoe report in the United Kingdom. Now I'll just show you the latest graphic for the overall prevalence from the Zoe app. And there we see it, and it really has gone down. So if we look at, so this is when Omicron basically started, the first wave of Omicron. This is the BA2 wave, and indeed perhaps the other subvariant wave. Now the data from the UK in terms of the subvariants of Omicron is now a month old. So we're getting new data this week. So we'll look at that as soon as we get it. I suspect, though, that we'll find that quite a bit of this hump here, this BA2 hump, is related to BA2 variants or subvariants. I don't think it's related to the XE recombination variant. But we see the numbers are going down slightly, yet we do notice that this line here is still 2.5 million. So we have more than 2.5 million active cases in the UK at the moment. The numbers are still high, but they are definitely going down. And this data is still accurate. This COVID symptom tracker data, despite losing government funding, is still accurate. Tim Spector and his team are doing a great job keeping this going. Although how they're funding it, I really don't know. They must be really struggling. It's a pity, but there we go. That's what the government have decided to do. But that is still genuine data, and it's very encouraging as we head into the warmer weather. Now let's just look at some of this Zoe data here. Cases are down in the UK in all age groups and regions. Everywhere's down. So the R0 now in the UK is 0.8 overall. Now there are regional differences, of course, but actually not that much. Scotland was dropping quicker than other places, but other places are catching up now with the Scottish decline. And actually 0.8 below 1, this means there's actually an exponential decrease in numbers of people. And this will, I'm sure, this will carry on into the warmer weather period. But as we've said, it's still 1 in 20 people are currently infected. There is still a lot of this around. Now, because there's a lot of COVID around, but remarkably, or dropping levels of hospitalizations, this is actually good. So 1 in 20 people are currently infected. I could rephrase that to saying that 1 in 20 are currently having their immune system stimulated by the natural virus to generate natural immunity to the totality of this virus, not to just part of the virus as is given by vaccination. And I'm expecting this immunity to prevent serious illness and death for some time into the future. Still don't know how long. A year, 2 years, levels of protection after that, I would expect. But the point is, because this is endemic, we're going to be continuously reinfected now every 6 months, while still enjoying a high level of protection. But then in 6 months' time, when I get it again, that's going to boost my immunity again. That's why this is going to become irrelevant, or not irrelevant, it's going to become much less important. Not because the virus is going away, but because it will affect us much, much less, as we are immune to this in the same way that we are immune to thousands, tens of thousands of other pathogens in our environment, because we live in a microbiological swamp, a milieu of viruses and bacteria that our amazing immune system protects us against. And I had a really good comment yesterday. I can't remember who made it, but we were talking about Bill Gates's plan to get rid of respiratory viruses, COVID and influenza. Now, we pointed out why the plan was scientifically flawed, in my view, yesterday. We pointed that out. But someone actually said, well, even if you could do this, would it be desirable? Because it's the constant stimulation with viruses and bacteria that are stimulating our immune system. And that's good to protect us against these organisms. But also, when your immune system is stimulated, that helps to protect us against cancer as well. So if a cancer cell arises, and cancer cells arise in you and me, I'm afraid, every day. I get cancer every day, probably. In fact, I'm pretty sure I do. But thankfully, God willing, we won't get that disease in the short-term future at least. And because the immune system eradicates the cells. So if you've got a good immune system, sensitized by exposure to lots of viruses and bacteria, and your immune system's on its toes, it's well trained, a cancer cell pops up, the immune system will say, oh, that's a cancer cell, and whap, it'll just eradicate it in literally over a course of minutes with cytotoxic lymphocytes, T lymphocytes, for example. It'll just kill the whole cell, which is good. But if you've got a defective immune system, it might not recognise the cancer cell, and the cancer cell could divide, which, of course, that's what cancer is. It's an out-of-control cell division with a proliferation of malignant cells, which will eventually spread locally and metastasise via the lymphatics and blood system, so-called hematogenic spread, to cause metastases. That's what cancer is, of course. That's why it's such a terrible disease. So stimulation by these ongoing viruses and ongoing bacteria reduces our chances of getting cancer. So it's actually not desirable to eradicate respiratory viruses. But of course, Bill Gates isn't medically trained, so we wouldn't have expected him necessarily to know that. But he did write the book, though. Anyway, and that was yesterday's video. Government cases are about 20% of infections. So in other words, these government figures that we are seeing are just a glorious irrelevance now, because only about 20% of cases are actually being infected. But having said that, if we do look at the last few months, we do see it going down. So you could argue this is representing 20% of infections. Well, in fact, it is representing about 20% of infections. Now, Tim Spector's team's come up with another clinical feature. Not for the first time. The power of citizen science is impressive. And I've got more news on that. I won't go into it now, but I've just received the Zoe nutritional kit, which I'm going to be showing you. So I'll be eating some Zoe muffins and testing my blood fat and blood sugar after that in context of my microbiome. But we'll look at that at another time. But a fascinating, huge study coming up from Zoe, and I'm delighted to be one of the first people to be doing that in the UK. But full video report on that as soon as I get time to do that. Tinnitus. Very distressing feature. I've looked after people, well, not that you can do much very often, but they're absolutely distraught with ongoing tinnitus, this ringing in the ears. And they often have to play music or particular sounds to try and suppress it. Very distressing feature, tinnitus or ringing in the ears. Can often also be a side effect of aspirin overdose, incidentally. But he actually had a sample size of 5,000 people who reported tinnitus as a feature. And again, the advantage of large-scale citizen science, 5,000 cases, is a one heck of a good number. Now, for most people, the tinnitus lasted for a couple of days, then it got better. Now, the people that are getting tinnitus It's a bit unclear actually at the moment whether these people suffer from tinnitus anyway and it's just made it worse, or whether they're new. It seems to be a bit of both. But it seems the people that are getting the worst tinnitus already have some, and it exacerbates the condition. So some people it's an exacerbation, some it's new. So there's actually a bit of both there. For most people it's moderate or intermittent, which gives them some respite. But for 50% of the people that suffer it, it's for weeks or months. So this minority of people that suffer from tinnitus, but it was a group of 5,000 in the Covis symptom tracker study. And of course, that's only a very small subset of the total population of the country and of the world. 50% had it for weeks or months. And as we said, Tim Spector's also now doing research on cancer, menopause, childhood viral hepatitis, and all these things depend on people reporting. So do consider downloading the Zoe app and reporting. And it is an important aspect of citizen science, and I have no financial interest in this or at all. It's entirely scientific. Now, Tim Spector also gave the latest list of symptoms as reported, and again these are accurate. Now, runny nose, the amount of people with a runny nose just seems to go up and up and up, so it's 84%. So 84% of people with Omicron infection, with COVID infection at the moment, 84% of those get a runny nose. Now, if you haven't got a runny nose, that doesn't mean you haven't got it, but 84% of people that do have the virus do get a runny nose. 72% got fatigue, sore throat 69%, headache 68%, persistent cough. And this is accurate data. It stayed fairly consistent, although the percentages have creeped up. Sneezing, so 69% of people who get COVID infection are sneezing. Headache, persistent cough, hoarse voice, chills or shivers, joint pain, dizziness, fever, brain fog, sore eyes, altered smell 26%. Muscle pain is 23%, lower back pain, common feature 23%. A lot of people have had that. Quite bad in many cases. It's like the fatigue. I mean, 72% get fatigue. Sometimes it's mild. Other people, it can be debilitating and go on for a few days or even weeks, or even develop into long COVID. So the severity of these symptoms varies quite a lot between individuals. Swollen glands, that's the lymph nodes. Where are we? Swollen glands, there we are. Skip meals, not feeling hungry. Ear ringing, tinnitus, 19% of people got that. Diarrhoea also occurs, but without a particular number. Now, seeing I've got the UK data up, I'll just show you a bit more of this. So that was cases. Let's look at healthcare, which, as we see, is going down nicely. So here was the start of the Omicron wave, about here. We'll zoom into that a bit. So November, December, started about then. Cases went up. This is hospitalizations. Not because it's more pathogenic, but because the sheer number of the people getting it. And we've got a very clear BA1 wave and a BA1 wave here and a BA2 wave there in terms of hospitalisation, but no question now that it's going down. So that's good to see. That's patients admitted to hospital, patients actually in hospital. Again, just look at the last month's data, definitely going down. The last 3 months' data, we're getting over the BA2. So there's the BA1 hump, there's the BA2 hump. Definitely going down nicely now, and I expect that to continue. And thankfully, patients in mechanically ventilated beds. So if we look at the last year, this was where Omicron came in, started kicking in about then. And since then, it has done nothing but go down pretty well all the time. Now, there is a slight bounce. If we look at the last 6 months, there's a slight bounce here. And again, this is associated with the Omicron BA2 time. And this is just because of the sheer volume of patients, the sheer number of people becoming infected. So when you've got 1 in 13 people in the population infected, you get these numbers. And of course, some of them were admitted with Omicron, not for Omicron. And when we look at deaths in the UK, again, so this is official deaths. So this is deaths after 28 days after a diagnosis. We are seeing the grey data starting to fall, and the actual data, well, it's much lower than it has been, but it's still there. There's no question about that. So what have we actually got? Daily deaths here. Last 7 days, 1,560, where it's mentioned on the deaths. Sorry, 1,560 after a positive test. Actually, on the death certificate, just over 1,000. But there again, we do tend to get deaths starts to go down this time of year with influenza, and we really haven't had the influenza. So these exacerbations of chronic obstructive airways disease are really quite common. So part of these deaths is not increasing the overall excess mortality, because some of these deaths are replacing deaths that would have occurred from other viral infections. But there we go. The trend is good for the United Kingdom, and I'll just leave you with this most encouraging graphic here, and I am expecting these numbers to continue also. I'm going to look at the States in a minute. Well, when I get around to it, I've got some material to talk about the States. But we are seeing, I believe, they're not going down as rapidly as the actual infections aren't going down as rapidly in the States, because the BA2 bounce occurred much later. But I would expect the United States to be mirroring this trend really pretty soon in the next few weeks. So very encouraging as the summer months occur. Of course, we have next winter to contend with. We looked at Denmark, which actually suspended will be suspending its vaccination program in 2 weeks' time. Possibly, though, starting it again for those at risk, or for specified people in the autumn. So we could see a resurgence of cases in autumn, but then we always see a resurgence of viral infections in autumn anyway. So I'm basically happy that the vast majority of this pandemic is now over, and hopefully we'll move on to other interesting things soon. But for now, thank you for watching. But I feel encouraged. My reservation is the deaths are still there in the UK. When they start to go down a bit more, and they will, as summer months occur, they will. I guess when you look at these numbers, you're just sort of confronted with the reality of mortality, and it's sobering. But thank you for watching.